Welcome to this disability rights discussion group. If you are in need of ASL, please come to the front so that you can be part of this discussion. My name is Reverend Robert Blair. I'm the minister at Unitarian Universalist Congregation here in Fullerton, and the lights go on. That happens whenever I say my name. This glow. We are so glad that you are with us so that we can be the best allies that we can as people in Orange County, as different communities of faith. We are coming together with love and intention in order to be the best allies that we can be. So I invite you to listen with those full stomachs. So grateful for the cooks today in giving us a wonderful meal. And I would like to introduce someone who has been working on this for a couple of months. She has put her heart and soul and sweat and tears into doing this. And just want to give her the gratitude that she deserves, that she will probably have a hard time accepting, but I want to introduce to you sort of the heart of what we're doing, and that is Debbie. Debbie.
Thank you. And thank you all so very much for coming today. And if we can have the next slide. I want to make sure that everybody has access to this. If you need captions, you can join live stream Zoom and check the closed caption feature. So I have a lot of people to thank. They say it takes a village to make things happen. Well, it takes a congregation and then some. And I want to thank everyone on our Social Action Committee. My name is Debbie Longenbacher. I'm chair of the Social Action Committee at Unitarian Universalist Congregation here in Fullerton. And want to thank Reverend Rob for his work on this and his support. A huge shout out to our office administrator, Amy, and thanks to all of the congregation, folks who have helped out to make this event happen today. So next slide. So the Sunday after the election last November, our Social Action Committee got together and we discussed Project 2025 and considered what areas of that document where we could work and possibly make a difference on a local basis. So we came up with several different ideas. We sent out a survey to the entire congregation, and disability rights was one of the top concerns that people had. And that spurred our work to make this event today happen. Now, for today, I've asked our presenters to answer 3 questions. The first question is, what about Project 2025 concerns you as far as rights for people with disabilities? The second question is, what solutions do you see as possible for those concerns? And then for individuals who live with disabilities, what do you want professionals to know? So I can promise you a few things today. You're going to learn something new and something important. And you're going to have, before you leave this building, you're going to have opportunities to do something to make a difference. Now, I'd like you to silence your cell phones, but do keep the camera available because you might want to take some pictures of some of the slides in one of our presentations. So thank you so very much. And I would like to introduce our first presenter, Dr. Shana Charles. She is Mayor Pro Tem in Fullerton and is a public health professor at Cal State University in Fullerton. She's a nationally recognized expert on public policy and a firm believer in promoting community health through good governance. She has over 25 years of policy experience from the White House to local community service agencies. And she has earned 3 degrees from UCLA, including a PhD in health policy. So please join me in welcoming Dr. Shana Charles.
This is why I need the handheld, pardon me. You can't see me back here. Hi, okay, fantastic. I'm much more comfortable out here. Hi, everybody. Okay, so for those of you who don't know me, it's very nice to meet you, and I hope that you will talk to me after this program so I can get to know you. And just a quick plug, as a professor, I have open office hours, so I brought that to City Hall. And all of you are welcome to talk to me on Thursdays from 12 to 2 in City Hall, or the last week of the month, I'm out in the community. This week, I'm spending my Thursday from 12 to 2 in lovely Laguna Lake Park. You're happy to come join me out there. And also, I'm available by email, phone, I take texts even. You can contact me lots of ways. So I just want to extend that invitation to you, and please feel empowered to reach out to me with anything that you would like to discuss after this presentation or moving forward, living here in Fullerton. So I am a public health professor. I started working in policy in the mid-90s. My very first office job, I went from working retail over the summer to an internship in the fall with the White House, in the Bill Clinton White House, in the Office of Women's Initiatives and Outreach. And after I came back from that experience, I decided to really focus on policy. And so at the UCLA school, my first class on disability policy was in the late 90s, taught by a professor who has since passed away, sadly, but who was one of the last people in this country who got polio as a kid and was in a wheelchair for his entire life. And as he pointed out, and one of the things that's always stuck with me, other folks would call it confined to a wheelchair. And he said, the wheelchair gave me my freedom, my mobility, my independence. It is absolutely not confinement. It is how I live my life. And just hearing that from a person shifted my perspective in my 20s. Right? And so I think that's part of what we all need to talk about. Because, and the reason why I bring that up first is because Project 2025, which I've been asked to talk about, specifically has the purpose of erasing words and erasing stories and erasing narratives. And I wish I was lying to you about this. I wish I was exaggerating. I wish this was a political topic. It's not. This is policy. And it's what's happening to our National Institutes of Health, to our CDC, to the Health and Human Services Department, to the Department of Education, which you might have just heard the news that all kids with special needs, like my 2 children, both of whom were under IEPs going through school and are still, one of them is still here at Fullerton College. Those kids are being moved out of the Department of Education into the Department of Health and Human Services. And they're demanding, under Project 2025, they've already put in this action. And unfortunately, it is an internal action. And so the lawsuits are progressing, but they're not going fast enough. It's already happened that any grant through any of those agencies to researchers, to community groups that uses words like disability or inclusion or equity. I don't know if you've seen the list. It's a long list of words that are now not able to be used. By the way, one of those words is female and woman. If you use those words in your grant or description of what you're doing, I personally know people who have gotten their funds yanked. I'm lucky being a Cal State Fullerton professor. My job is funded by the state of California to teach. And when I get external grants, I get extra money, I get course releases, but it's not my actual salary. My actual salary is to teach my 4 classes a semester. Other folks, the UC system, private universities, most academics don't live like that. Most academics fund their own salaries through these grants. And when your grant goes away, when your grant ends, when your grant gets yanked in the middle of it, you have now lost your job. And so all this research on disability access, on inclusivity, on equity is all going out the window. And it's erasing the story, because if you don't even talk about what's going on, we don't know how to fix things. Now, I see a woman here that I'm going to call out for a second, because I know you hate attention, but Maureen, you keep me honest. I think of you as my Jiminy Cricket. Maureen comes to every council meeting, and if she can't make it in person, she'll be there on Zoom. And literally, when her voice comes on over the Zoom, we all light up. We're like, oh, it's Maureen talking, yay, because we know her so well. And every 2 weeks, every time, she speaks to the council and to the public and at lots of different meetings about what it's like to live here in Fullerton as a person living with disabilities, and how we need to do better on our street development, how we need to do better in building our buildings, how we need to do better in our curb cuts, all of these things. And it keeps us honest, because I can say I'm trying really hard, and if other folks are ignoring it, they have to be honest about ignoring it, because Maureen is speaking, right? It doesn't give you anywhere to hide when you use these words and you tell us what's actually going on. So that's really important, to speak up, and that's part of what I'm very worried about with Project 2025, is that it is erasing people's ability to speak. Another thing that I'm concerned about, and I'm going to talk here now about the Affordable Care Act. And my area of expertise is actually health insurance and access to care expansions. I've been doing that since 2001 when I wrote my thesis on the expansion of the Children's Health Insurance Program. You might have heard of that. That helped cover kids whose parents were working. They weren't eligible for Medicaid because they made just too much money. So that's where I started my career in policy, was working on that in 2000, that thesis. And so I was already established at the UCLA Center for Health Policy Research. We were working on expanding this large, humongous bill called the Affordable Care Act. And honestly, people who were opposed to it were calling it Obamacare. So you might know it by that name. It has now been adopted as the name that most people know, but I still call it the Affordable Care Act. So that was 15 years ago today that President Obama signed that into law. Today is the 15th anniversary of the Affordable Care Act. I remember exactly where I was 15 years ago when that was signed. I was in my office at the Center for Health Policy Research, and we were having a big party. We were very happy. 6 weeks before that, in mid-January of that year, I remember where I was too. The law was about to die. It was about to die in Congress. And the reason it was about to die was because we had lost Senator Ted Kennedy, and his vote was replaced by another senator who did not like that Affordable Care Act. And so it couldn't go back to the Senate. That Senate vote had to stand. And that meant that Nancy Pelosi had to do a Herculean task of getting a bill through the House that about a fourth of her own caucus, we had about a 60-person majority-ish at the time, but a lot of people in her caucus didn't want it. And it would be a very tight vote. And it was about to die. And I remember I went to a conference in Washington, D.C., and it was this Families USA conference. If you haven't been connected with this group, it's a wonderful advocacy group on behalf of consumers, and they push for universal health care. And they took us to the Capitol as part of this conference if we wanted to go, and we stood there in the rotunda with signs promoting the Affordable Care Act. We're doing some yelling. And it hit me then. This was now 2009. I had been working on, 2010. And I had been working on this project for many, many years. But in 2010, something was different for me. By 2010, I was married with 2 young children. And now it was really personal. I realized standing there yelling for the first time, because my daughter had been diagnosed just 2 years earlier with epilepsy. A lifelong condition, right? We didn't know what was going to happen. Maybe she would grow out of it. We didn't know. And I had just had my second kid, and my second kid, who I use the word kid because my second is non-binary, as they have informed me. So we use that. My kid was born, and 4 days later, they found hypothyroidism in that huge screening that they do for all the things. So I knew I had 2 kids with special needs they each had their own team of specialists. I had a kid with a neurologist. I had a kid with a pediatric endocrinologist. They were using that healthcare that I was getting through my job at UCLA. And I realized what I'm fighting for is their future. My kids are going to grow up, and if they're anything like me, and if the system's still like it was, when I graduated college, I got kicked off of my parents' insurance because I'm no longer a student. I was 21 years old with no job. And there was no option for me because as a childless adult, didn't matter how much money I make, Medicaid didn't exist for people who don't have kids at that time. There would have been I would have been uninsured, by the way, as a kid whose dad was a doctor in Kaiser. Okay? The only reason I wasn't uninsured is because my dad was a doctor in Kaiser and told me, oh, you fight that rejection they gave you. They rejected me at 21 years old as being uninsurable. They wouldn't give me coverage that I wanted to pay them for because they said I had chronic back pain. I had gone to one appointment and had been diagnosed with back pain. Didn't even fulfill the Vicodin prescription because I'm a little worried about that. So that's how difficult getting healthcare was at that time. I did win the appeal, so I ended up being able to pay them for the privilege of getting coverage that they could prorate for me, and also at the time could say, well, we'll cover everything except your back. That's the things that could happen. I knew if my kids grew up in that system, when they graduated college, which by the way, neither of them did. One of them still hasn't even graduated high school yet because they're getting a GED. They're on very different life paths. So that has taught me that disabilities change your life path and you go with it, right? You got to go with the flow. Things do not always happen rigidly every day. You can't get up every day and get to a 7:30 a.m. class and stay there till 3:30 when you're living with 5 complicated disabilities like my kid ended up being, as we found out over the years. Okay? Just can't, and that's fine. River is doing all sorts of things that are amazing, but they're not on that path. So if the Affordable Care Act hadn't passed, they both would have lost their health insurance once they turned 18 and were no longer students, right? Or weren't even enrolled in Fullerton College. They both would be completely uninsurable because of their childhood conditions that they've had since birth. Neither one would be eligible for Medicaid unless somehow they managed to have children, which in the case of my kid would be mentally life-threatening. We've had discussions about this. My non-binary kid has been very clear about they would find the prospect of becoming pregnant and having their physical body go through something that their soul does not want to do to be something so hazardous to their health that would be life-threatening in a mental health situation, right? So it became really personal for me on that day when I realized, and I didn't even know what I was getting into later. But that day, I was like, 2 young kids with special needs. I was like, this is what we're fighting for. That was the end of January. And I actually ended up helping over the next 6 weeks to pass the Affordable Care Act, by the way. And if you want to have coffee or meet me in my office hours, I will tell you that whole story because it's a great story, but I don't want to necessarily take up all my time here with that. I'm still good, right? Okay. I teach classes that are an hour and 15 minutes long. I lose track of time. So the Affordable Care Act now protects our kids up to age 26, so they're more established, even if they're married. But God, don't let them get married that young. Don't do that. But up till they turn age 26, they can stay on their parents' coverage now. And I will tell you, my college students at Cal State Fullerton are all shocked to hear that that was part of the Affordable Care Act. For them, that's just life. That's just their lives. Okay? The kids now, whether or not they have their own children, they can get on Medicaid, but not everywhere in this country. Only in, we're up to 41 states plus the District of Columbia that have passed that expansion. There are still 9 states in this country where the old rules still apply. And it will not surprise you to hear that those 9 states are in the Deep South and in Texas, right? Those are the states. However, it might surprise you to hear that when it was passed in 2010, it was bipartisan in some states to pass it and to enact it and to expand. Arizona is my favorite example of that. A really horrible human being named Jan Brewer was for the Affordable Care Act, even though she's terrible in so many other ways. And she actually, as the governor of that state at the time, even more conservative than it is now, vetoed every piece of legislation that came to her until her very conservative legislature sent her the Medicaid expansion bill. Medicaid is absolutely a bipartisan popular issue in this country. There have been propositions in deep red states where they elect people who oppose Medicaid for some reason up and down the ballot, but then on the proposition they say, oh no, you have to expand our Medicaid. And then they try to get those people to do it, which has not always gone so well. But It is absolutely a bipartisan issue. There have been states where conservative governors who refused to expand Medicaid were kicked out of office. And ones who said they would expand Medicaid came in, and then they did it. And the reason I keep talking about Medicaid is because, for those of you who know, Medicaid is the largest insurer of people with disabilities in this country, not just by income, but also by the way the Medicaid eligibility rules are written, and nursing home care, assisted living care. Your Medicaid. And by the way, in case you don't know, 44 million people in this country are living with disabilities. That's about 1 in 8. That's a little bit over the entire population of the state of California and Canada, because we're as big as Canada. Okay? So living with a disability is not something that is weird. It is not something that is abnormal. It is larger than most groups in this country. It is something that we cover with a health insurance program, a public health insurance program that covers about 85 million people in this country. By the way, about 20 million people on Medicare are also Medi-Medis, right? They're dual eligible for both programs. And there's also this band of about 15% of people on Medicare who are there only because they're permanently disabled. And after that 2-year mark, you get on Medicare, okay? Which means you don't have to worry about your income eligibility anymore. So, oh, that's for 5 minutes. I got 5 minutes left. All right. But this is the world we're living in. We all have people in our families with disabilities. I don't think I'm alone, where I have my kids. I also have my parents now, right? They have aged into their disabilities. And boy, is my mom not happy about it. But we're living with it, and I'm trying to encourage her to use the tools. It is also something that can happen to anybody at any age due to unforeseeable events. I myself am lucky to be standing here without a cane or crutches tonight. I'm only about a week and a half off of that, okay? Because I injured myself in mid-January, and it took me physical therapy and all of this time to heal. And I am lucky that I injured myself to that capacity where I could heal. The human body doesn't always heal, right? Sometimes what you've done is permanent, and you just have to live with it, move forward, and figure out what you need and accept yourself as you are moving forward. But these health insurance programs are vital. And that is also what Project 2025 is cutting. They want to cut $1 trillion out of the budget, and they're going to cut it from these programs at this point. I will say the one bright spot that I've seen is that the folks who are in charge of these chambers of Congress are ashamed of this and are saying in public, no, that's not what they're going to do. At the very least, they feel some shame. The problem is they're lying. Yes, it is what they're going to do. The Congressional Budget Office, which is a nonpartisan organization, they're the ones who told us that the Affordable Care Act was going to be a good first step, but about 10% of the country would still be uninsured. By the way, we are now at a 7% uninsured rate. The Affordable Care Act has actually done better than anticipated, but we always knew we needed to do more. It wasn't going to go far enough. So Medicare for all, we got to get there. We're going to get there. I really believe that. But the Congressional Budget Office said, there's no other way to cut $1 trillion out of the budget with your legislative priorities, Congress, that you have said, if you're not going to cut Medicare and Medicaid. And who that hurts is the most vulnerable people. When you look at Medicaid distribution of enrollment versus spending, enrollment, about 10% are people who are elderly, about 11% are people living with disabilities who are not elderly. You can combine that to 21% because we all know that just human beings as they age get disabilities as we go. We all know that. Nobody here is going to be in perfect health every day. And we need to stop treating it like it's not normal. It's normal. Anyway, that 21% of enrollees cost about 55% of the healthcare dollars. And that is good. That is appropriate. We want people who need healthcare to get healthcare, right? That's a public health perspective. I would much rather spend that money on this than spend it on another bomber or two that we're not using. Thank you. Yeah, let's do some snaps. Right? And we need to bring that public health perspective to Congress, to the state legislature, and for the seat, when the seat became open, by the way, representing Cal State Fullerton, where I also teach. I looked at the two other people who were running. I'm going to finish here. They both called themselves businessmen. that corporation tell me that is exactly what we need in our local government, is somebody with a public health perspective. It is a bipartisan issue. Do not be afraid to talk to everybody about this and to be loud about it. Be loud about the healthcare that we need, that we deserve, and that we need to keep, despite what people in power who have this Project 2025 narrative, despite what they want to do to us. We're going to make sure it doesn't happen. Thank you.
Thank you, Shana. That was wonderful. And for our next speaker, and this is one where you might want to take out your cell phone to take a picture of some of the slides. Our next speaker is Shelby Harris. And Shelby lives with a number of health conditions and has some unique ways of how she has worked with her health insurance over the years. So please welcome Shelby.
Hey, I'm Shelby, and can you believe that in the past year and a couple months, I was in the hospital 3 times, not once, not twice, 3 times, because my health insurance denied my medication. I'm here to share my story because I want to share with you all a way that's a solution, or where are my slides, by the way, Gordon? I have slides. There we go. Okay. So I want to share with you all real quick, just a real quick backstory. I have 5 chronic autoimmune diseases, primarily type 1 diabetes and rheumatoid arthritis. So what does this mean, all these conditions? I'm a high use user. Look at, for my type 1 diabetes, I wear implantable devices that do my insulin and my blood sugar. These are required. Insurance, you guys, they don't like to pay for my stuff because my stuff is expensive. And they don't like to spend a lot of money. They like to deny and delay. It's a systematic denial and delay. So what I would like to share with you is that I have solutions, because when they deny and delay, it's very stressful. I want to share real quick a little more expansion on what I told you earlier. Within 9 months, my health insurance plan denied my rheumatoid arthritis medication, and I wound up in the hospital 3 times. And this was medication that they had covered for like 3 years, because I've had my plan for years. So it was really stressful. So what I would like to share with you all is some solutions to get through that. Okay, my rheumatologist told me about, and I'm going to get to this later in the slides, but I want to show you my 3-step approach. My rheumatologist was horrified that I wound up in the hospital 3 times in 9 months. And she was like, hey, there's this Department of Insurance. You could file a claim or a complaint. And so I want to show you this process I go through to file my claims. The first step is you do not take no for an answer. Insurance companies are going to say no to you about everything. They do not want to pay. So when you know to not say no, not accept no, you got to fight. This is Queen Boudica, everybody. She's a warrior queen. Now it's exhausting when you have multiple chronic conditions, but you have to have an intestinal strength, fortitude. The only way to get approval sometimes is to actually fight. And so let me check in where I'm at, everybody. Okay, guess what? We're ready to go to the next slide. So once you realize you got to fight, the first step is that you file a grievance with your health plan. I have a picture here that's a picture of my health plan. And just so you kind of get an idea, you can't do this on those 1-800 or 888 numbers, but you'll be on hold for 58 minutes. So I suggest you go online and you get access to your health plan. And for example, my health plan, way at the bottom of the page, a little teeny tiny grievance. You click that and you do it online. I was always kind of worried that how long it would take. You guys, it takes like 4 or 5 minutes instead of the, hour and 20 minutes on hold with your health plan. So once the grievance is filed, you get like a, hey, you filed a grievance. Thank you very much. Guess what? Now, this is the meat and potatoes of what I want to share with everybody. My rheumatologist told me about the Department of Insurance. So I filed my claim and complaint, and they were so nice. They called me. They said, you know what, actually, because of the health plan that you have to go to the Department of Managed Healthcare. Now, I wanted to show you both of these, and I just wanted to give you an idea. These are like they're California-run organizations that are kind of like watchdogs on health plans. So the point of Department of Managed Healthcare, the mission of the California Department of Managed Healthcare is to protect consumers' healthcare rights and ensure a stable healthcare delivery system. And I'm here to tell you that they absolutely do this. So I then filed my second complaint with the Department of Managed Healthcare. If we could go to the next slide, I just want to give you an idea of what the website looks like so you see how to navigate it. You can see that you can either call this anytime I've called this number, they're super kind. Thank you very much. And again, it is best if you file online. You get all your information in there and then they will call you, okay? If we could go to the next slide. Now, one more thing I wanted to show you. Do you file a complaint or claim with the Department of Insurance or with the Department of Managed Healthcare? And the truth of the matter is it really depends on your health plan. A lot of people here at the UCF are Medicare. Some Medicare, it's the Department of Insurance. Some Medicare, like if you have a supplemental, that's the Department of Managed Healthcare. The bottom line is you can go on the Department of Managed Healthcare's website, and towards the bottom, my nice little black arrow, it basically says view all health plans. You can see if your health plan is there. If you don't want to do that, you can just call the 800 number that I hope everybody got a picture of that. You can call that 800 number and they're just happy to help you. It's an amazing thing. So now if we could take a look, I just wanted to show you the Department of Insurance. So if we go to the next slide. So here's their website. Now the Department of Insurance is for all insurance, homeowners insurance, car insurance, all that. But they are the same thing. You can either call the 800 number that's nice and big, take a picture if you want, or you can file a complaint. And again, the 800 numbers, they are so kind and they will direct you and help you. But it's the best thing that you can do is to file a complaint online. Hopefully everybody can have if it's hard to navigate web pages for some people, get somebody support, maybe somebody in the congregation could help, because it's best to do it online. So what I would like to share next, if we could go forward. Oh, look at this. Liberation. I want to talk about this for a minute here because there's a point to filing these claims and filing these complaints. What I was doing for 6 weeks when my insurance wasn't getting covered, I was crying, I was pulling my hair out, and I was like screaming. That's not healthy, is it? Is that productive? No. A lot of people, it's one of those things. Everybody likes to talk about their insurance and how horrible they are. And talking is really important to, talk to your friends and your family. But the bottom line is that this is a productive and it's a systematic approach to go against the system that is constantly denying you and delaying and not wanting to pay for your daily meds. Like, hey, I take insulin, everybody. It's like the 5th most expensive liquid in the world. They've even tried to deny my insulin. Like, what is that? I need to live. Health insurance. Thank you. So the reason why I want to spend a little more time here with the time I have left is because this is my approach. Instead of what I was just mentioning, being stressed or just crying and, beating my head against a wall kind of to say, the minute that I get a denial, hey, I'm not going to take no for an answer. And then I go to my insurance page, file my grievance, get my, hey, your grievance is filed. And then I go to the Department of Managed Healthcare, type in, and I have filed another claim. Department of Managed Healthcare probably knows Shelby because now I just do this. In January, they tried to deny, I'm just going to show you my insulin pump. They tried to deny my insulin pump, but guess what? I already had a prior authorization approved. How are they now going to deny when you've got the prior authorization? It made no sense. Instead of saying it made no sense and crying, I filed my grievance. I filed my claim with the Department of Managed Healthcare. Same woman, hey, Shelby. I'm like, hey. She's like, did they really deny your insulin pump? I'm like, yeah. And guess what? Within 24 to 48 hours, see what happens was when you file these claims and complaints, the Department of Managed Healthcare calls the health plan. And the health plan is like, uh-oh, tries to explain us that, oh my gosh, are we in trouble? Then I get a case person who calls me, oh, Shelby, next time call us. We really want to help you. No, they don't, right? Like, no, if you wanted to help me, I wouldn't have not had my medicine for 6 weeks and wound up in the hospital. So these cases absolutely help and get empowered. What was the time? Oh, I gotta hurry, everybody. So guess what? We get empowered. And these cases, when you build these, all of these claims live with like the Department of Managed Healthcare. If somebody winds up suing a health plan, Department of Managed Healthcare, they have these amazing data analysts and they pull through and they could find my information and that would help that court case so that we could finally go up against the health plans. And guess what? Which I'm really good at, everybody. Our voices get heard when we file these claims. So I'm pretty sure I'm done with time, but just to wrap it up, there is things that you can do so that you're not always stressed and sad and don't have your medication. These are really fundamental, easy things to do. And I wish you luck. I'm Shelby. Hit me up. Happy to help. Thanks, everybody.
And thank you, Shelby. Lots of good advice, hopefully is helpful to you folks. I'd like to introduce our next panelist, Donovan Rinker-Morris. After graduating from Harvard Law School, Donovan practiced international law in the Middle East for almost a decade, representing clients ranging from victims of human rights abuses to governments and multinational corporations. Since returning to California, he's practiced law in a wide range of fields, handling matters such as immigration, asylum, clients, tenant rights, advocacy, worker rights, and disability. And he has 2 adorable 4-year-old twins.
Who are not in the room at the moment. I think they might have needed to step outside. Oh, there they are. Hey, girls. Thank you so much for the opportunity to speak. I come to the topic of disability rights and disability law through my grandmother, who suffered polio during the Great Depression. And that left her unable to walk very well. She could walk with the assistance of a cane and a brace, but she certainly couldn't pull down a job in her part of Washington. When she went through that in the 1930s, there was a system in place to try to help individuals who were injured on the job, but it didn't access most of the people who actually needed disability assistance. So we passed the Social Security Act and we created areas that have become Social Security disability and other areas of law that grew out of that 1935, 1936. And those laws didn't fix the problem. 30 years later, we enacted the Medicaid and Medicare as we know it. I think Medicaid's celebrating its 60th year's anniversary this July. And the system helped a great deal for people in a position like my grandmother. But the system had certain features that are very distinct from the Social Security Disability Act and from what existed before we had Social Security. And that was essentially a system called workers' comp. Now, I'm bringing it up because Project 2025 invokes aspects that come out of a system that has nothing to do with healthcare, from traditions that nobody thinks of in a context of disability rights. Work restrictions, we have never used that as a basis for determining healthcare eligibility anywhere other than in a workers' comp or in certain social services where means tests operate. And currently, 9 out of 10 people who are receiving Medicaid nationwide are either working or they are seeking employment or they are enrolled in school or they are disabled or have a disability that prevents them from. So if we were to enact a work restriction, how could that possibly get us to $880 billion in cuts unless we start looking into those communities? Well, we can't look at people who already have a job because they have a job. They already are meeting the work restriction. And we can't look at people who are in end of life care because they are in end of life care and they're probably not looking for employment as they face the end of their life. So what community is going to be affected by a work restriction? And that term pops up in Project 2025 as if it was a solution that could get us to $880 billion in cuts. It makes no sense to somebody who is struggling with a disability, but it does to the kinds of people who advise the kinds of people who draft plans like Project 2025. I'm raising that because there's only so many ways we can do 880 billion in cuts. The federal government can cut its match to the states. And in the state of California, our Medi-Cal system is approximately 50% funded by the state of California and 50% by the federal government. It's actually a little bit more than that, but it balances out. If that were cut, say, from 50 to 40%, then the state of California can immediately pass that down to the health providers and tell them you need to fire a certain number of staffers, you need to stop providing care for people. They can start planning around the numbers in the HIT. They can start borrowing money. And all those are things that happened in 2009 when California first proposed a 10% cut across the board and then reduced that to 5%. We have hospitals that are still struggling to make their budgets balance after what happened more than 10 years ago. And many hospitals and providers have closed down across the state. But that's what we did in response to the emergency from the financial crisis. And it had implications that were at least manageable. People could know who was and who wasn't going to be covered, how to pay for it. The other way to make an $880 billion cut that's a little bit harder is to tell people you're no longer covered for certain services. We tried that as well in California. We cut podiatry, chiropractic services, dental services, and other services under Medicaid at one point in time. Some of that is being restored, some of that isn't. When you tell people you are no longer covered, at least they know they don't have coverage and they can try to plan what to do with their life. But both of those require politicians who are willing to honestly say, I am voting to cut something. What happens when they're not willing to honestly say that? And that's where we get to the world I live in, where people impose work restrictions and things that make no sense to individuals who are suffering, or they create a fraud management system. And this is something that if you've been paying attention for the last 2 months, we're hearing an awful lot about fraud, not a lot of it based on the type of work that is necessary to actually find fraud. But there is a legal system that operates where fraud mitigation is quite central to the process, where insurance companies will spend $50,000, say, on legal fees to avoid paying $20,000 on medical costs. And that's the workers' comp system. Now, what happens when the doctors and the insurance companies are told, when the doctors are told by the lawyers how to practice medicine, the doctors don't know what to do. They'll code whatever they can to get covered and they will comply. But that kind of a system where currently, for example, the Medicaid system requires states to provide 210 days of end-of-life care that's compensated. And then they adjust that with certain numbers of days, providing additional care for focused treatment. So in the state of California, it's 7 days of reimbursement. In Florida, it's 5 days. In Alabama, it's 4 days. And Minnesota, it's 14 days, I believe. Those types of terms cost potentially many thousands of dollars per day. It gets funded through a system that is designed to provide medical care. If you take the public health side of it out of it and put it under the control of people who are preventing fraud, the way that they do that is much closer to what you see in workers' comp, where you need a lawyer or an insurance company's permission for a doctor to diagnose you in the first place and determine if you needed any treatment. And then once that treatment is identified by a doctor, it still can't go forward until it gets reviewed by another doctor. And it takes time. It might take 6 weeks to fight with a healthcare system to get treatment. It can take years to get the basics under this system. But it doesn't cost the federal government anything. And it permits them to prevent fraud, all without anybody knowing exactly what is happening, who's outside of this ridiculous system. It was a system that was so objectionable that we created public health to prevent anybody from falling into it who didn't belong there. And it exists and it's in play in California and across the rest of the country. So when I read Project 2025, I read it as advising political figures how to claim that they are about mitigating fraud and how they are claiming that they are preventing people from getting services who are not entitled to them. But I see that very differently from the claim. It looks to me as something bad faith that doesn't come out of public health, but from a totally different tradition. Now, what can we do about that? And right now, the first good news is it hasn't happened yet. 880 billion in cuts were identified last month, but it has to go to a committee. That committee gets to decide whether to do that to Medicaid, as they tried 8 years ago, or to do that to Medicaid and Medicare, or not to do that at all. But the problem is your stories have power in the right place at the right time when developed into something that can help stop this from happening. And they have answers to claims like, are you going to cut my Medicaid? Somebody who intends to vote in favor of a Project 2025 design plan may be able to tell you with a straight face, oh, I will never vote to cut Medicare. I will never vote to cut Medicaid. And then graft into the system something that doesn't belong there, that would force somebody to make a proof or showing that has no logical purpose within the healthcare delivery system. How do we fight that? We fight that by developing these stories together, calling congresspersons, talking to experts and advocates, and doing it not just once, hoping that it goes away, but developing it. I spend a lot of my time during the work week telling people how not to tell their story, at least not in the form that's going to hurt them, because it is so easy for the wrong person to take a story and then strip it of its power and use it to do the opposite of what you expected from telling that story. So a public forum among friends and people who are supportive is so crucial. None of us realized that we were going to have to become this kind of an advocate in our lives. And it is imperative for all of us to find ways to empower the stories that nobody is hearing, to reach out and find some way to develop them and get them among the audiences where they can do us some good. Thank you so much.
Thank you, Donovan. I'd like to introduce our next speaker, Dr. Carter Rakowski, and she's the chair of the sociology department at Cal State University Fullerton. She earned her doctorate at the University of Massachusetts in Amherst and previously has worked for the Veterans Administration. She is a congregant of UUCF, and she's a wife and proud mother of 10-year-old twin boys. And about 25 years ago, she suffered a spinal cord injury in a motor vehicle accident. So please welcome Dr. Rakovsky.
Thank you. Thank you to the Social Action Committee at UUCF for coordinating this event. Thank you to all the members of UUCF for your support, not just today, but in my life generally. I cry. And thank you to Reverend Rob for promoting this, and to First Christian and Reverend Mandy for your support. I'm so grateful to be in community with all of you. I also want to thank everyone who's here today listening, and that you took this lovely Sunday afternoon to come and hear about disability rights. So I would echo what a lot of people have said. The most concerning things to me about Project 2025 are the cuts to education and students with disabilities. Healthcare, as already it's difficult to get durable medical equipment. I love Dr. Shana's story. Like, I love my wheelchair. When I had my kids and we'd be in the playground, little kids would come up and yeah, look at my wheelchair. It's great. I love it. It gets me everywhere. I can be out in the world because of it. But it is hard to get equipment. And I'm concerned about anti-DEI policies that could lead to a loss of equity for people with disabilities in the workplace, and less research for chronic conditions or rare conditions. Some solutions and actions we can, for people with disabilities. There is a local organization called Triumph, the Triumph Foundation, and you can come see me. I can tell you about it, but they help people with disabilities do different things. And like next Saturday, they'll have a big event where we can ride bikes. And I went last year, was the first time I had ever ridden a bike with my kids because they have the bikes there and they help you get in them. So anybody who is looking to volunteer, they're a great group. Also, to be in community with people generally. This is a time where we feel like we're the only ones nervous or scared or outraged, and being in community with people will then help you be in community with people with disabilities because they're everywhere. And accepting and celebrating the diversity of bodies, minds, experiences, and ways of being in the world. Recognizing when we are hearing these messages that people who can go fast and break things are the people we should respect. That is not the only way to be in the world, and we can recognize those narratives and interrupt them. And I wanted to mention the social model of disability in case you haven't heard it. Most of you probably have, but that is that it's not like the impairment that I have that prevents me from being in the world. It's the society and the way it's structured that can then cause me to have a disability. So because my wheelchair is so great and works well for me, I have wheelchair parking, the handicap parking. I'm not disabled really because I can live a full life. When I was first injured and I went out for the first few times in the world, I would see these little blue and white wheelchair signs everywhere. And it was so amazing. I was like, thank you, thank you. All the people that had fought so hard for the ADA, for the disability rights in California, which was even, I think, in the 70s. I think you were the first state to have. I'm not from here. So when I came here, it's just wonderful. The access is so amazing. But we might be going into a situation where the government support for those things could be going away or could be illegal, right? All the anti-DA, anti-accessibility. So we have to work together to provide the access and to keep fighting for access. Those are my main points. I just want to thank everybody again for being here and for supporting. And if you're not sure what someone needs, just ask them. And disability is not a bad word, as you all know. We've been saying it a lot. It's a positive word. And please just ask if you are around people with disabilities, you don't know what they need, or just ask us. And thank you all.
Thank you so much, Carter. Our next speaker is Dr. Jesse Weller. He's a clinical psychologist and the executive director of the San Gabriel Pomona Regional Center, which is one of 21 regional centers across California dedicated to serving clients with developmental disabilities. San Gabriel Pomona Regional Center covers 30 cities in the far eastern part of Los Angeles County, and that includes Altadena, where the Eaton Canyon fires were a couple months back, and where we'll be raising money to support those folks. The Regional Center is a nonprofit organization that operates under contract with the State of California Department of Developmental Services with the mission to deliver essential services and supports to individuals with intellectual and developmental disabilities. So please welcome Dr. Weller.
I think I can try this. Can everybody hear me okay? Okay, perfect. Thank you, Dr. Debbie. I think I'm afraid to touch it. I think it works. Okay, let me know if this doesn't work. I have the privilege and honor of working with Dr. Debbie previously, and she's a gem. So I appreciate you so much. And I appreciate hearing all the stories up here today. And I'm sitting here reflecting on Dr. Carter and your words and just the importance of listening to people's stories. You never know by looking at somebody, what somebody has been through or what their journey has been like. And so I think it's always a nice reminder to stop and pause and reflect and get to know people and to listen. I think it's really, really important. I wanted to start off today by talking a little bit about Regional Center. This a raise of hands if you can. Who knows Regional Center or has heard of Regional Center? Got some people. Okay, great. I'll just do a little history in the interest of time, but I just think it's such an important part of our history as we're thinking about some of the questions today. California is the only state that has an entitlement program, meaning that if you have an intellectual or developmental disability, which in California is considered an intellectual disability, autism spectrum disorder for autism, cerebral palsy, epilepsy, and this other category, the way that I describe it, that you kind of meet the criteria, you're almost there, but it doesn't quite meet one of those thresholds. It allows for you to receive lifelong services in California to support an individual in their support needs. As Dr. Debbie mentioned in the intro, I have the honor and privilege of being at San Gabriel Pomona, and we're one of the regional centers, and there's 20 other that make up 21. It's an important history. In the 60s, going back in time here, there was a period where individuals that had disabilities were either in institutions or locked settings or encouraged to be in settings that were locked or not secured away from their homes and communities, which isn't correct. Luckily, the state caught up over time and started putting together a system that we know as regional centers, which is a network of community-based systems. And we get the privilege and honor at regional centers to help people live the life that they deserve, live a life that they want to live, be that with their family, in their own apartment, with supports in a residential setting. And we all know, I think we can agree that we don't need to have people excluded from the community because of their disability. And so there's a strong history there that I think is really important when we look at our future. Given the fact that we're an entitlement program in California, serving as Debbie mentioned earlier, my intro, 18,000 people for our regional center. Across the state, we're approaching over 500,000 people relying on services from us. And we're expected to grow another 40,000 over the next year. That means more people are coming to us, which is fantastic. And with California, knowing that we're an entitlement program, that means that people have to get services. We can't say no. We can't say we can't serve you. We can't get your services in place. But what's a little scary to us at this point is our funding is mostly state funds. However, about between 36 and 37% are federal funds. That equates to about 5.4 billion. If we were to lose that or have parts of that reduced, that could really impact day-to-day living for people. And so we don't know yet what that interpretation to our system looks like, but there's a lot of fear, a lot of anxiety, a lot of stress. I think we heard some of it today already, of what happens if that funding is cut. And we just don't know. We don't know yet what that looks like. In California, what we would typically see, given for regional centers, I'm focusing on this aspect for today's conversation, would be to pull money from somewhere to make this programming work. But if you think about additional cuts, what happens when it starts getting more reductions or if there's more risk to certain areas for people's lives? Not the first time we've seen a fiscal crisis for our system. If people that were in our system in 2009, you might have heard or have seen, if you're a user of regional center, a fiscal crisis that just limited certain services and put caps on certain areas, and that just can become a hardship. Imagine if you're a parent or caregiver trying to provide the love and care and supervision for your child or children with disabilities. If you have a few hours taken away out of that week, that can be life-changing for a family. Imagine telling somebody they can't go to their program or go to work that day because there's no transportation. So there's some real scary things out there, and I keep telling my community and the people that I'm working with that we are in this together. We will always find a path forward. I think one of the areas I'm very focused on is to continue mobilizing. And what do I mean by that? Staying involved locally. So know your legislators, know your local assembly members, senators. They have offices in the areas that you live, and stay vocal. Stay really attuned with their offices, and let them know the importance of what these services mean to you. Even on the federal side, I'm sure everyone's hearing the same thing around Medi-Cal and home supportive services, insurance. These are the times you're seeing rallies kind of occurring across the state. I saw one in Sacramento last week when I was up there. You're just seeing communities come together, and I just share with everybody, while I don't have all the solutions at the moment, I know the power of sticking together as a community, sharing your stories and really sharing with legislators what would happen if I lose this, what my life will look like if this is taken away from me, because those are the stories that I think are going to persist and make a difference. And so thinking of question one, those are some of the areas that come to mind. The other area that I wanted to briefly touch upon is regarding our Early Start federal regulation program. In some states, as you may or may not know, children birth through 3 are entitled to early intervention. And in California, those services are delivered by regional centers. In other states, it might be through the school district or other entities. And so with that being a federal program, that's been another area of concern for people in such critical milestones of development, asking about federal cuts and federal funding. And we don't have any information as of today what that looks like. You can just see how all of these pieces come together, causing concern for individuals who rely on these much needed services. So we have our work cut out, but I appreciate any opportunity to have conversations, to share ideas, share collective experiences, that we can continue to keep the mobilizing going full force and to keep doing our part, because when I think back on regional centers, our system exists today because of a group of moms that advocated, just like we're talking about today. And so I have this philosophy that if parents can start our system that we have today in California for people with intellectual and developmental disabilities, we can do the same thing in 2025 and keep it going of educating, providing information, and what I call grassroots, being boots on the ground out there, however that looks like. So just want to provide a little bit of perspective. I'm happy to answer questions afterwards. I'm sure there might be some opportunities or to at least get connected. So thank you for having me in your space today. And I'll turn it back to Dr. Debbie.
Thank you so much, Dr. Jesse. And when we're finished with speakers, we will pass the mic around for questions. Our next speaker is Bruce Reback. He is a congregant of UUCF who lives with cerebral palsy. Early on, he was enrolled in special education and then matriculated to regular classes in junior high and high school, and eventually earned a degree in organizational behavior and human resources. And throughout his life, he's had a number of different occupations, and he has a few things that he'd like to share with all of you.
Good afternoon. First, I'd like to thank Debbie Lawson for asking me to be on the panel. When Debbie asked me to talk about my concerns with Project 2025 when it pertained to rights and services for people with disabilities, I was happy to apply. As I dug deeper into the content of Project 2025, I was horrified to what I have learned. I hate to use a strong word, horrified, but that was the word that came to mind. To give you some background about myself, I was born with cerebral palsy, like Debbie mentioned. Because of my middle class white background, I was fortunate to have the necessary services, physical therapy, occupational therapy, given to me to improve my life and give me the opportunity to be a productive individual in society. I was in elementary school for children with special needs. My parents had the foresight when I was in sixth grade to take me out of the special school with special needs, put me into regular school, because they felt my chances to go on to college would increase rather than to stay in the track of being into the, continue with the school where I was. So I did go. I went to Cal Poly Pomona. Like Debbie had mentioned, I majored in business management with the emphasis in HR, human resources, and organizational behavior. I graduated cum laude. After college, I went on to become an affirmative action peace analyst for the first Interstate Bank of California, if you remember, first Interstate Bank way back in the 1980s, that was eventually taken over by Wells Fargo in 1996. my position was to develop a affirmative action plan in accordance with governmental regulations. Based on the plan, my job was to find where we can improve our numbers pertaining to the hiring and promoting of women, minorities, and people with disability in different positions, different job positions in the bank. This meant talking to district managers around the state. I had experience I'd like to share with you. One of the districts was our county, and I had to go down to the Cincinnati office to speak to the district manager. And basically, the district manager didn't really want to spend the time with me because I had a lot to say, and the black composition of blacks in the bank were very low compared to the composition of the population of Water County. He did not want to really speak to me. He did, but he had better things to do, running a bank, running a district. The other thing too is I talked to I did outreach programs with organizations like the Urban League, or GLAD, which is a greater Los Angeles for the Deaf, and UCP, United Cerebral Palsy Foundation, to name a few, to recruit quality applications. After 5 years of corporate life, my family called me back to the family business, which I did for 15 years. At that time, I decided to put off my MSW degree on hold. Well, when we retired out of the business, I went back to school and received my degree in early education, early childhood education, with the emphasis in special education for children and for adults. I started working with adults with developmental disabilities. I joined the organization called Valley Village in the San Fernando Valley from 2007 to 2017. They were made up of daycare center and 14 group homes for their clients, the high functioning, high working in the business community, contributing to society, giving them high esteem. I worked in many group homes. In my primary group home, where am I? In my primary group home, I witnessed my house manager was up against budget constraints, like many other group homes and daycare centers. Some years we had to cut back a lot, and most of the money came from clients who 2025 want to collect even more Social Security benefit and Medicaid even further, with family picking up the rest. It's impossible for the family to bear the burden. There really is no war room for cuts. Just this week, the Trump administration dismantled the Department of Education. The Trump administration said that he is not going to touch funding for children with special needs. I don't agree with that. I just don't agree with that for 1 minute, and hopefully that will not happen. In closing, we all have to work together. We can't allow the disability community to be left out. We really can't. We cannot continue to cut service for the disability community. Please write to your government officials to put a stop to this injustice. Thank you.
Thank you, Bruce. Our last speaker today is Fernando Oliveras IV. He's a two-time cancer survivor and part of the disability community, adolescent and young adult cancer community. His mission is to connect people to better services, and he works on this by hosting social meetup gatherings, educating the community about disability history, which he has here with the ADA portable museum in back of the sanctuary. And he says that we know when a person has no connection to community or resources, it can result in their being institutionalized. So please join me to welcome Fernando Oliveras to tell you a little bit about himself and the ADA Museum.
We. Hey guys. So, man, a lot's going on right now. But I also seen a lot of things were happening in the past. As mentioned, I have a little museum in the back. It's just a few of the pictures that were taken. But there's a lot of history that people don't know about us with disabilities. And so for me, I feel privileged to be able to share the things that happened in the past. Just because the younger folks, they think that the rights and the things that we have just came out of the blue. And so for me, what I'm trying to do, I'm trying to make sure that the young folks can see this history, can see what was taken from us to do what we need right now, you know? So that's what I'm doing, where I'm pushing this history to schools, colleges, anywhere where I can be at. Just because this history is getting, you know, our rights, our basic needs, our access is disappearing right in front of our eyes. And so for me, that's why I'm just so really passionate to just get this museum out there, just because it's really more than just pictures in a museum. And so for me, man, when I see that there's a loss of this, a cut of that, I'm like, okay, so what can I do in this whole grand scheme, you know? And so me, by either exhibiting, hosting a meetup where people can gather and join and just have a good meal, is my little part that I am doing. And I'm hoping you guys can do the same, where you guys can, you know, talk to your legislators, do something where you can do for the disability community, if it's just a local gathering, or just, you know, talk to us, sit with us. Just because right now we're in a time where we're really losing that humanity part, you know? And so that's where I'm appreciated that this is open. And I'm able to display this history, just because not that many places will allow me to do these things, you know? So I appreciate you guys taking the time, the energy, and all that's what it takes to be here, because, you know, as a service provider, I'm seeing a lot of fear. So many service providers are like, what about this? What do I do there? You know, and so for me, I'm like, whoa. Let's see if we can talk to legislators. Let's see if we can talk to service. Let's get collective, you know, because that's what they did back in the day when you know those resources didn't exist. They marched, they protest, they all gathered. If you look at it, they're all together. that's where I feel like we got to go back into that history and be collective. Because if we're so spread apart and things are happening really fast, how are we going to support each other? So I really, wish that we could just be in a time where we find like this type of place where we can be either eating a meal, finding our legislator, or something where we can, you know, you break bread. And so for us, I don't want to live in a world where I see more dividedness, and so that's why I wish, I could be in more places to share this history because I'm not sure. Have you guys even heard about disability history? I'm curious. Crickets, crickets, crickets. Thank you. Yeah, some of us. And so, that's why I really want this movement to continue. I don't want the history timeline of the disability movement just to end at the 60s or the 70s or the 90s. I want to continue. I want to create this new movement of folks that see what happened in the past and talk to their ancestors or talk to people that were in that movement and be able like, hey, how do I create this new protest? Or how do I create this new change? So you got the new folks saying, okay, I want to be part of it because right now we're feeling defeated. And I don't want that to happen with us because there's so much potential. It's ridiculous how much potential we have. But we keep seeing loss there, cuts there, then it feels like we're defeated. And that's where I'm just really, pushing this out there where, hey, let's all either like I said, eat a meal together. Let's just have some fun, and then we'll go work because life is really tough, especially with us with disabilities. So that's where I really want to push it to. Like, if we want us to be part of this society, make it accessible. Either a ramp, an interpreter, have things in braille, just have access for us. If you look at some of the pictures, curb cups wasn't even a thing. A person with a wheelchair, a rollator, medical durable equipment wasn't able to even go on the side of the curb or get off the curb because curb cups, wasn't something that people thought of or even considered. And what we did in the past, we had a sledgehammer, and there's a pictures of them sledgehammering the curb cups, and that's what we need to find ways where we can innovate, how we can change the systems, because it's really up to us, not to Uncle Sam or whatever government officials there. And if they are there, we need to send them a letter. We got to figure out how do we get to them to understand us. Or we either have to call, what's that show called? We're Undercover Boss. Like, man, we got to figure out how they can see us the way we see each other, And so that's why I hope that you guys can see this history, not just for those images and things that happened in the past. I feel like this history has a bigger impact. So when you look at this, I feel like, okay, you felt what I felt was, man, inspiration, a light that just was something that I didn't see. And so that's why I hope and wish that you guys can see this history more than what I have these images, but can connect with us as a community. So I appreciate you guys for the time and everything that you guys do. Gracias.
Okay, thank you so much, Fernando, and thank you to all of our wonderful presenters today. So we have time for a few questions. So raise your hand and Aaron will bring the mic around and we'll pass the mic to whoever you would address the question to. One.
Oh, I didn't turn it on. Thank you so much, everyone, for being here and for sharing so much amazing stories and wisdom. My question maybe is specifically for people with a policy or legal background. I'm an educator, and I'm particularly worried about the lawsuit Texas v. Becerra that's moving through the courts trying to get rid of Section 504. I wanted to know if any of you have any good hopes for that particular piece of legislation, or if you know if that would affect us here in California. It's, for those of you who don't know, it's 17 states are attempting to get rid of Section 504 because they added gender dysphoria as one of the legal. Am I talking and then you're all just gonna be like, I don't know. I don't know if anyone. Okay. Hi. Okay. Hello. Yeah, I just wondered if any of you have any information about that, or if there's any particular good news or hope for us here in California with that moving through the courts.
All right. Okay. And I'll come over here so that you can see me. Hi. So I'll answer with a little bit of a vignette about how much things have changed, and I wish it could give more hope. But nationally speaking, we used to have super strong protections with the Supreme Court that at least pretended to uphold precedent when it came to these kind of justice issues. Dobbs completely blew that away. And a year and a half before Dobbs, Texas, again, Mississippi had started it first, and the other states have been doing this constantly. They'd always been shot down about reproductive justice, trying to chip away at that by the Supreme Court upholding Roe v. Wade. And federal judge after federal judge said that those restrictions that you're trying to put into place are not legal and have to go away. I remember my kid asking me, do we have to worry about this case going through Texas with the Supreme Court in about 2021? And I said, no, of course not. It's going to get shot down. It's absolutely, of course it's unconstitutional. You can see that. And I was completely 100% wrong with the Supreme Court that we have now. And they did enact the Dobbs decision. And it completely stripped away precedent. The Supreme Court decision had been overturned in order to roll back rights. I mean, we've had overturns before, but before it was to promote human rights, and now we're rolling it back. So we're talking about 504 plans, and we're talking about, rights for people with disabilities and adding in gender dysphoria, which I very much care about on a personal level on that. And I wish I could say I trust the Supreme Court. I do not at all. My kid is saying to me, I will never move out of California because California is where I'm protected. So that is the good news. California, even if something happens at the national level, should be able to uphold its own state laws that would also have these protections. Unfortunately, I wish I could say I'm 100% confident in that too. We have had cases where the Supreme Court has said, well, now that we've overturned it, now you can't do that. And I don't know if that would apply here or not. So I would say this is an excellent time to speak out, to file a friend of the court. I appreciate that you brought up the 10% rollback. I don't remember which did that. The 10% rollback in 2009 of funding, because as a researcher, I was part of a brief, a friend of the court brief, that my data was used to show how harmful that 10% cut would be. And it was one of the reasons why it didn't end up happening. The judge looked at that and said, okay, so we know that's going to be harmful. So like I said before, speaking out matters. Make sure, California stays safe by doing that. But the best thing we can do, honestly, is try and make sure that elected officials at all levels, it matters who's in the seats. And there are people who are supportive of these things from Texas, in seats from Texas. There are people who are supportive from Florida. Now they're the minorities in those states, but they still exist. We need to support across the country people being in these seats that support our values, and we will see change over time. We will. My husband, who was here briefly and then had to leave and go off to a work call, likes to remind me that in 2004, the Supreme Court was actually more lopsided 7-2 in terms of conservative majority. And all it took was winning Obama for 2 terms in a row. But that didn't seem hard at that time. It seemed like a proper right thing to do, right? And we were able to move things over. So things can change over time. That's my hopeful note.
Thank you.
I'll try to follow that, but I will raise that 10% across the board cut from 2009, because It was rolled back in part by people like you speaking up. They proposed 10%. They reduced it to 5% because of the incredible outcry from people who were going to be cut off and lose their services that they relied upon. And there were legislators in California in 2009 who listened. Do we have legislators like that in Congress? Maybe some of them, yes. Maybe some of them, no. I don't know until we speak to them. And that's probably the most important piece of this. Now, in specific to the Texas versus Becerra on the 504, because there's other Texas versus Becerra claims that are also outstanding, I think it is quite likely we're going to lose some of the federal civil rights protections. I am sorry, I cannot see how they're going to survive the current court makeup. What that means in California, again, I think is going to come down largely to who we speak to and whether we take it and give up. Dr. Charles is completely right. Sometimes when they strike down a protection, there's a way that the federal government can prevent a state from creating that protection again. That's unusual. That's only when the civil rights protection is actually regarded as an oppression that violates somebody else's rights that tends to happen. So I'm optimistic that the state of California can pick up on issues, especially considering gender and other issues affecting our community that touch in the disability rights world, but also touch on many other critical civil rights and identity considerations. If you don't know your state assembly members and state senators, I strongly recommend getting to know them because if the federal protections fail, that's your last line of defense. The communities are going to try too. I mean, don't get me wrong. Orange County, Los Angeles County, our neighbors have lots of professionals who are sounding the alarms and doing everything that they can. But most of them who are administrating are too busy administering to become advocates. And that's where we've got to find our elected officials and advocates wherever we can and bring them into the picture. I'm sorry that's not a very clear answer on your question about pending litigation that is so critical. I don't know what's going to happen. I am not optimistic, though, that we're going to be able to carry and protect each one of the pieces. Supreme Court is what it is, and elections matter. And unfortunately, the votes aren't going to be there in Congress to restore laws that have been, I mean, Section 504, by the way, this is 1973. This isn't new law that is being threatened with being overturned. This is 52 years of law that is on the chopping block right now, as is the case with many other long-standing principles that date back to an era when I wasn't even, but they matter immensely. And it's worth following all the ones that you can, but even better, worth getting to know your legislators and elected officials.
Briefly, I'm so sorry to come back, but I just thought of one more thing. Because where I live in Fullerton is Placentia Yorba Linda School District. And we should know that. And Placentia Yorba Linda School District, these school board members, it matters who's on those very local seats, especially with issues like this. The difference between that school board and the Fullerton School District Board, night and day. Although the voters went and spoke and reversed some of those things, right? And got some better people in the seats last time. So if this is an issue you care about, make sure you really look at what people are talking about in their campaigns, what the most recent things they've said. I regret to say that a person that I have voted for in the past who's in charge of this state currently has backpedaled on things like gender dysphoria recently to the point where I will, yeah, I'm not voting for that person again, regardless of what they run for. And that matters, right? You have to hold to that principle. Okay, thank you.
Wonderful, thank you. Does anybody else have any questions?
Good afternoon, everyone. Thank you so much for being here. I've learned a great deal. I will start with Dr. Charles. From what I've learned today, do you, I don't know if you were at UCLA a long time ago, but do you remember a doctor by the name of Margaret Jones, or have you ever heard of her? Oh, okay. And I would like everyone's business card, please, because I'll have questions. And the young lady that talked about the insurance, my big question on that one, were you talking about the state commission or the federal commissions? It's all state?
I am loud. It was all state because they're state-run organizations or like watchdog group, agent. I couldn't think of that word. This is why we have such smarty people, right? Thank you. What I will tell you is that when I was trying to do some research for this and I was asking about Medicare, they specifically said that this is for people who live in California, these two groups. So I admit that if there's something going on in another state, I could only hope that there's also Department of Managed Health Cares for that state and Department of Insurances in each state. What I provided was all California.
All California. That's
Correct.
what I needed to know because we have the insurance commissioner that you can always go to, and they can always tell you where to go.
They are all very kind, and I had that. His picture was up on there, and those 800 numbers are absolute resources. I am directing everybody and encouraging everyone. Just call. They are ready to help and ready to inform and ready to make more complaints and claims so that we all get our medicine and durable medical equipment covered, as we should, because we pay for it if you're not on Medi-Cal, of course.
The other thing is the squeaky wheel gets the grease. Speak, speak, speak. It took me months and months and months when I would stand up at city council and tell them about the heavy doors we have at Fullerton City Council. And when they shut down for a month for technical upgrades, I threatened the whole council. I said, if something isn't done, I don't care what it is. You know how slow city goes, but something needed to be done. And I don't care what it was. But when I came back after they reopened the council chambers, nothing had been done. And so when I threatened city council before they closed down, I says, if something isn't done, you will feel my wrath. And when I came back to city council, nothing had been done. And I called Dale McIntosh Center the next day. And the day after that, they were out measuring the weight of the doors. Both doors at Fullerton City Council weighed 11 pounds. And nobody with a disability, including myself, and I have some leverage, can get that door open. So you've got to, as I say, when I go up there, I have my 3-minute gripes, and I say that politely. So the thing is, just keep it up. You've got to keep talking. And I'm so glad to see Dr. Charles off of her cane, and it's good to see that. So I'm glad she's back to normal. But thank you so very much for being here, and I hope you have I'd like to see another one of these at least twice a year, if not 3 times a year. So more and more people could be know about it and can plan for it. Thank you.
Thank you. Does anybody else have any questions?
Hi, my name is Laura. I didn't know this was going on today, but thank you all for your information, especially Donovan and Jesse. I have a little tip. Years ago, Red I Am Radio, and I'm born here. Guatemala friends of mine in LA reported that to me, 200 million in Social Security head honchos in Orange County's pocket. Did you know that? So, and the mayor on journalism of cable I grew up with, the mayor right now in LA, she's pocketing like college money. So I have to say, for Donovan, especially the lawyer with your power and Jesse, the Dr. Shrinker. That's some knowledge for you. A little tip. Thank you. It's in their pockets. Have a nice day.
Thank you.
I was in 2 hospitals and 2 nursing homes for the better part of 17 months before returning here to the church on January 15th when I tried to get into the Fullerton homeless shelter after I got denied 4 times by Hope Center to get into there coming out of those facilities, because some of the facilities I was coming out of were in Los Angeles County, when I wanted to be in this particular shelter program that's down the street here in Fullerton, because I know somebody that lives there and I would feel more comfortable there. Why is Hope Center making it so difficult to get in there when I've been a member of First Christian Church for 17 years and I have a Fullerton contact in this church body? Why are they not looking at page 2 of my background report, which shows the membership with this church on it? Why are they only looking at what's on page 1?
I mean, I'm not an expert, but it's systematic. And I'm sorry that that happened. And now we're going to have Dr.
It's supposed to be a low barrier.
This is a
navigation
question on
center.
homeless services in the Hope Center, and I agree with you. And thank you for. I was actually going to come talk to you after the panel, but I appreciate you mentioning your story. I don't. That's an excellent question. While you were saying that, I was thinking the same thing. Why aren't they looking at that? And so, before we leave, I want to make sure we get that information. And if they already have a file, that started for you, I think we need to talk about that. I know the Illumination Foundation, is that the one you're referring to? We have a few different centers.
Curtis Gamble
Okay.
does that.
Yeah, so the Illumination Foundation, I think, is really interesting for our discussion here, because for the folks who don't know, they are actually a nationally recognized organization because for the first time, they have incorporated full health services, including mental and dental health, on site. And it's actually open to the public. So there's the shelter part in the back that has, dorm housing, and it takes pets, which is also unusual and is a full thing. But then in the front is a full clinic that if you are a Medi-Cal enrollee, you can use that as your clinic if you want. So it's not just for folks in the shelter, it's also open to the public. And so they're using this new program called CalAIM that allows for Medi-Cal to be able to pay for housing services also through healthcare dollars. And it really, I think, emphasizes that anyone who experiences being unhoused, by definition, is going to need more services, because just that experience is a difficult and traumatic experience to go through. And my heart certainly goes out to anyone experiencing that or has experienced it in the past. So if you're telling me you've already contacted the Hope Shelter 4 times, I'm sorry, the Hope Center is someone that can get them into Illumination. You have to be there.
It's wanting to refer
Right.
to Mercy House, and Mercy House is having problems in some of their shelters.
Right. So we're going to have a longer conversation about this, because I want to make sure that you get the services that you deserve and are entitled to.
My girlfriend volunteers in both shelters.
Okay.
Volunteer helps in both shelters right now. She's
Yeah.
got
So we'll have this
privileges that are
conversation
instilled
afterwards, but
with-
we'll let these folks go and about the rest of their day, but you and I definitely need to talk. But I think that emphasizes for people also, when we're looking at these policies, how there's just so many intersections, right? All these things fit together. And I think talking about institutions over here and regional center work, I mean, all of this is we're trying to enable people to live their best lives. That is really what we're here for. What other point is there? And so that all fits together also with housing services sometimes.
Thank you, everybody. I told you at the beginning that you were going to learn something new, and you did. And I also said that there were going to be some opportunities for you to do something today to make a difference. So you can see in the slide that we're asking for donations to help people with disabilities who were affected by the Eaton Canyon fire. We're going to be passing the basket. And the next slide has some Venmo and PayPal links if you prefer to donate in that way. And we also earlier, we had a wonderful luncheon. We've got some great cooks in our congregation. And if you like to cook as much as I do, you will appreciate buying leftovers from that luncheon for $5 per serving. Also, as you're leaving, please spend some time, take a look at the ADA Mobile Museum that Fernando is sharing with us today. Also, on the back table, there's a list of various organizations that are very local to Fullerton and Orange County that provide services for people with disabilities. If you need one of those services, if you would like to volunteer for one of those organizations, or if you wish to donate, please use your phone, take a picture of that list, and do your research as far as what will be helpful. And then the third thing that we have that you can do today, and almost all of our panelists have alluded to this, is writing a letter to your legislator. Out in the narthex in the lobby, we have materials for letter writing, including stationery, stamps, addresses. We can help you determine who your congressional representative is. If you're not sure who that is, we have that list available for you. So again, 3 things you can do. Donate to help folks with disabilities affected by the fires. Or you can check the list of different organizations, find one that will suit your needs or your generous heart, and write a letter to your legislator. So again, thank you so much to our panel. And thanks to all of you for coming and supporting today.